Millions of Canadians are now dealing with thick smoke and poor air quality from those wildfires in Quebec and Ontario.
The impact of smoke is in large urban centers here and in other cities right across Ontario, some of the worst air conditions in North America.
Yeah, that's Minister Bill Blair there. In Ottawa yesterday, schools kept children inside. The Red Blacks, well, they canceled their outdoor practice with the city recording an air quality index that health officials called a very high risk to people's health. I mean, you can barely see the Parliament buildings there. For more, we are joined by Dr. Courtney Howard, an emergency physician and vice chair of the Global Climate and Health Alliance. Welcome to your morning.
Thanks for having me.
So we're showing pictures of Ottawa, but the smoke where we are in Toronto is thousands of kilometers away from those fires in Quebec. But you could definitely smell it, and in some places you could taste it. Those pictures from Ottawa yesterday were that air quality index at the highest level possible. What are the health effects that you want people to know about to stay safe?
Thanks. This is a very important conversation. So looking at the Air Quality Health Index site on Health Canada, the Toronto reading is still 7, which is high risk. Ottawa is at 10 plus, and I see that there's pretty high values right across the board. Yellowknife is at 10 plus as well. So at that level, everybody should be staying inside with the windows closed. If you need to go outside, what you can do is get an N95 mask. Those are the more beefy masks that you saw some people wearing during COVID. Make sure it fits your face properly so that when you're breathing in, the mask itself is filtering the particles. If that is the case, we can filter out about 90% of those particles. The problem is that this smoke is a product of all of the things that have burned. And so what we measure when we make the Air Quality Health Index, the most important part for wildfires is particulate matter less than 2.5 microns. So that doesn't discriminate in terms of what is in the smoke. It's just that it's very, very small particles that can fit through a very small grid. So those can go all the way down into your lungs and in fact cross into your bloodstream. So we're talking increased levels of asthma exacerbations, chronic obstructive pulmonary disease, increased levels of cardiac mortality even during these very severe effects. And unfortunately, we don't yet know what the long-term effects are of these short-term, very severe exposures.
It's great to hear your perspective on it because you can feel it in your eyes, you can feel it in your chest, but it's interesting to know what is actually in that smoke. Who is most at risk? Remind us.
Right. So the people who are most at risk are people who are already struggling with some pre-existing conditions. So if you have pre-existing heart or lung problems, if you have asthma, if you have chronic obstructive pulmonary disease, many times people will have to, even if they're doing their very best to avoid the smoke, change their medication. So talk to your doctor if that's the case. Pregnant women, children actually breathe in more liters of air per minute per kilogram of body weight than bigger people, so they end up with a bigger dose. Elderly people tend to have trouble, and of course anybody who is underhoused or whose house is more porous to the outside, so more smoke seeps in, and people who work outside.
Yeah, we can't, I mean, I really hear the message you're getting across with don't mess with this. This is just something to take seriously. The health effects aren't just physical though. How does this kind of smoke weigh on our mental health?
It's a great question, and the literature is just starting to come out about this. So in 2014 in Yellowknife, we actually had a full 2.5 months of wildfire smoke off and on, and we did a follow-up study. So we found a doubling of asthma exacerbations, a 50% increase in pneumonia, and when we did 30 community-based interviews that asked people how it felt to live through a really long period like that, people said that they felt anxious, they felt irritable, they felt a real disconnection from the land. So people who really enjoy gardening, who enjoy going out and fishing, really missed that. There was a bit of a food security consequence to that. And we know that being out in nature has a real big well-being benefit. And so when we're not in nature, we're feeling the lack of that. So ways that people can really help themselves are, number one, make sure you're getting enough sleep. An 8-hour sleep opportunity helps everybody cope with everything. Minimize caffeine, minimize alcohol. Try and exercise inside. Half an hour of exercise indoors can really, really improve your mental health. And when the air clears, make sure you lift all your windows open so that the smoke that's gathered in your house has the chance to escape, and you go out, see your community, get your dose of nature, get your exercise, and that will help you last through these difficult episodes.
Dr. Howard, great information today. Thanks for joining us.
Thanks for having me.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.